All right. Well, thanks for joining, everybody. My name is Josh Sabo. I'm the Executive Director of Heartland Housed. And today we're going to walk through a little bit about what the PIT count is, how we conduct it, some tips along the way. We'll show you the survey, and then we're also going to hear a story that sort of unfolded after last year's PIT count. So that's the game plan for this time together. We'll jump into just a section we call Pick Count 101. A lot of times people wonder what in the world this is. Why do we do it? The pit count is a literal count of all people experiencing homelessness in a community on a single night. So at a given point in time, it's conducted by every community across the nation. Every continuum of care has to conduct a pit count within the last 10 days of January, at least every other year. It's been our community's practice to do it every year so that we have this consistent data point as we make decisions and as we plan around the issue of homelessness. So really, when you think about what this is, what it can achieve, it's really a snapshot of homelessness for our community. Now, there's other data that can give us a better idea of what's happening in different programs and how the number of people accessing our system fluctuates throughout the year. But this one is just a given point in time snapshot of homelessness in Springfield and Sangamon County. Who's counted? The U.S. Department of Housing and Urban Development's definition of homelessness is the definition we use. And there are two main types of homelessness that we are seeking to count through the PIT count. What you all have agreed to be a part of is the unsheltered count. With the unsheltered count, we're working to count individuals or families whose primary nighttime residence is a public place not meant for human habitation. Examples of that could be a car, a park, abandoned building, bus stations, encampments throughout the community. Those of you that are involved in street outreach, you have a good grasp of often where folks might be staying if they're not accessing shelter or other services. At the same time, we also do a sheltered count. And so that allows us to count people who are utilizing emergency shelter services, transitional housing programs, and that becomes a part of our full count of folks experiencing homelessness in our community. We do this, like we said, it gives us that snapshot of data year over year. We can look at it and go back, a decade and sort of see how things have changed in our community. It helps us to measure and monitor trends in terms of the number of folks who are unsheltered, the number of folks who are using programs, and it helps our community as we think about what resources are needed, and even to make a case for more resources to better address the needs folks experiencing homelessness have. It's also something that we're required to do, as we mentioned, by HUD at least every 2 years. It becomes a data point that HUD uses to make funding decisions. Also, the state of Illinois, as they allocate funding for different programs to address homelessness, they also use the point in time count as a part of that. So it's really important for our community to have as accurate of a count as possible. All right. With that, I'm going to pass it over to Jamie. And Jamie's going to walk through the step-by-step how the PIT count is done with some tips along the way.
Thank you, Josh. And as Josh mentioned a couple of times, a lot of you on this call are, direct service providers or currently doing street outreach. So a lot of this is probably your day-to-day and ingrained in you, but it doesn't hurt to just kind of get a little refresher. So when approaching someone, make sure you're kind of immediately introducing yourself. If you're, giving them enough time to kind of adjust, like, oh, hey, someone's, coming and wanting to talk with me. Be polite and smile. Smiling goes a long way. Also, keep in mind that individuals sleeping outside might be dealing with active addiction. There might be mental health concerns, any traumatic histories. So just be mindful when approaching a person. Just be aware. Next slide, Josh. Sorry. What's one thing that you don't want to do is sneak up or kind of corner someone. So as I mentioned, identify yourself immediately. When you're walking up on someone, make sure that there's enough space that they have time to adjust, but don't ever sneak up on them. It's rude. Explain why you're there. Ask them if they have a couple of minutes to complete a survey. But main thing, after you introduce yourself, hey, nice to meet you. What's your name? This is blah, blah, blah. This is so and so. Explain what you're doing, explain your role that night, and see if they have a couple minutes to complete a survey. If they do say yes, then continue with the interview. If they don't want to answer any questions on the survey, that's totally fine. If you feel that you still maybe want to engage with them on just conversation, that's okay. But in the end, if they don't want to answer the questions, then just make sure that that's shared on the form and leave them with a bag. Even if they don't participate, I know it says participating, but my heartstring says to leave them with a bag and let them know, of any resources or of any kind, and then be on your way. Don't do these things, please. Don't just hand the survey to the client and ask them to complete it alone. Go through it with them. Ask questions slowly and make sure that they're understanding of the questions in its entirety. And then don't also assume any of the answers to any of the survey questions. Don't say, an example of that is, you're male, right? One of them would be, do you identify as a male or female? Just an example, but don't assume any of the questions. So go through each question in the survey form, like we said. They do have the right not to answer those questions. And then if you see, or if you think of any notes that might be helpful to include, write them down. It doesn't hurt. Yeah, simple as that. And don't force people to answer any of the questions if they don't want to. Kind of going back to it. If they just kind of don't engage or don't acknowledge it, just move on. No harm, no foul. Closing time. So once closing the interview, sorry. Once you're done with the interview or done with the survey, just thank them for their time, give them a bag, refer them to any services or resources. We will have our basic needs cards that we will hand out and you guys can provide. I'm sure we'll also have some of our business cards and those that are on the call, if you're doing outreach and you have your own business cards, feel free to please hand those out as well. Any connections that we can make, for those in the community that need resources, just, go along with it. Next slide, please. Oh, before we get to this, I think, Josh, you're going to take over for this if I'm correct, or is it me that's taking over?
Yep, I can take this on. So
I was just
again,
gonna say, oh, sorry. I was just gonna say before we get to that, I do think it's important that during the survey that you kind of make it a conversation. So, leave space for a personal conversation. A lot of the times folks out and about, they want to share certain anecdotes and maybe not everything, but I think that's important to keep in mind that it doesn't have to be such a rigid survey. It can genuinely be a conversation. And with that in mind, just be mindful of that individual's personal space, but also the physical space that they are at. So just kind of keep that in mind when you're engaging. And when in doubt, just follow the golden rule. That's my big thing. But anyways, thank you, Josh. Take it away.
good stuff, Jamie. As we mentioned, the significance of the unsheltered count is to really, as accurately as possible, get a picture of how many folks are unsheltered in our community. So, we know in doing outreach and other services, it can be difficult to know exactly who is homeless. So, we encourage folks to, or sorry, it's not always possible to determine if someone is experiencing illness based solely on how they look. So, we have to think through where do we see the person, what's the person doing, what time is it, to kind of make the best judgment possible. But the other part of that is to be generous in terms of who you approach. Letting people know, like, hey, we're out tonight, we're conducting the PIC count, and we're working to identify people who are experiencing homelessness. You can give people the introduction without making assumptions about whether that person is homeless or not. But the more that we sort of put those touches out there, the more likely we are to find folks who might be unsheltered. So The logistics of the count, we're going to meet at 8 p.m. Mercy Communities is letting us use their meeting room and parking lot as a launch location. So we'll kind of go through a couple of these things again that night. We'll also look at the geography of the county and kind of send people out to different places. Usually folks are hitting the road around 8:30. And then, we encourage groups to be available over the course of the next 2 to 3 hours to really carefully go to the known locations that are in their geographic area, but also to potentially take some time on foot, depending on what area you're assigned, to really try to find folks. It's not uncommon to find people, in parking decks or, in abandoned houses that we know might be frequently used. So sometimes it takes a little bit of time to seek out those places. So be prepared to spend some time on the count. A couple things we always touch for safety. So if you've not done the count before, one of the things that we do before we launch and send people out is to group people. Historically, the Springfield Police Department neighborhood police officers are a big part of the count. And so we will pair people who with the NPOs and go out to different locations. Some areas where we know there typically is a higher concentration of people that are unsheltered, like downtown, we might assign several groups so that folks can really sort of focus in and hopefully find as many people as possible through those efforts. So we don't send people out alone. We send people out in groups. As Jamie touched on, if a person's unsheltered in the dead of winter, they're likely dealing with a lot of complex challenges, and so you want to prioritize your own safety. If you don't feel safe, then if you're not with a neighborhood police officer, maybe you call us and we work to coordinate a different group to kind of go and engage that person. Or if a person is displaying, various symptoms, you might want to sort of step back and refer other services for that person. So we encourage your safety is the number one priority. So please keep that in mind and make decisions appropriately. We also ask people to not transport anyone other than volunteers in your personal vehicles. We are working on some different efforts that will go alongside the point in time count. You'll have the gift bags to give out to people. As Jamie mentioned, you'll have information on different resources. But if you engage a person who says, you know what, I'd really like to go to shelter, we're working on lining up transportation opportunities so that you could call and say, hey, we have a person that wants to get to shelter and help make that possible. So we want to line that up as opposed to you having a person jump in your car. Jamie really kind of touched on a lot of these already. Get consent, remembering that you're entering into a person's personal space. Really be respectful, right? Approach this in as conversational of a way as possible and respect the person's time. Please don't take personal photos with the folks that you survey. Don't ask questions, as Jamie said, in a way that assumes you know the answer. Don't insert yourself into a person's story, and don't force people to answer questions they don't want to answer. And also don't make promises you can't deliver, right? We wish that we could go out and promise people that if they would get on coordinated entry, we might have a way to house them in a couple weeks' time, but we know that's not the case. So as we're working to also connect people to resources, we want to be as honest about that as possible. On that note, I'm going to ask Nick, and while Nick is talking, I'll get the survey ready. But Nick, I'd love for you to sort of share the story of your experience last year doing the pit count and kind of using that as an opportunity to try to connect a person to further resources.
Hey everybody, Nick Dodson, Community Housing Navigator. Last year, when I did the pit count, I rode around with a couple of different service providers and one of our city's neighborhood police officers. While doing the pit count, we just started talking more and more about different folks in the community that have been experiencing homelessness for an extended period. And this officer mentioned a specific client that really pulled at his heartstrings and wanted to try and figure out a way to try and serve. So myself and Laura from Helping Hands started engaging this client in a very consistent fashion. We knew where he generally slept, where he generally was, engaged him where he was, and built a long-term relationship with this individual. This individual had a lot of distrust of the systems, a lot of paranoia of optimism of any results coming from these interactions. So about every week for, I think, 4 or 5 months, I would have lunch with this individual, try and build that, authentic, organic relationship to make sure that that individual knew that they could trust me. For a while, it got tumultuous, and they decided they didn't want to work with us for a while. And, with that being said, gave them space for 3 or 4 months, kind of surprised them with a little birthday gift to say, hey, I'm still here. I still care about you. If we can work together, I'm all in on supporting you. With that being said, this individual now has connected to payee services. They have connected to their healthcare. They have connected to food stamps. They have connected to what's looking like finally a housing opportunity. So I just want to remind everybody here that, relentless engagement and sometimes failing and not looking like you're going to get anywhere sometimes is a part of the process, right? So the pick count, while it can seem like an archaic process of going out in the cold to find these individuals and in their most, dire circumstances, I just want to keep in mind that, like, sometimes we can really change people's lives by just, continuing that engagement and helping them see an ember of hope either in themselves and in others. And I just want to encourage everyone to, sometimes it's uncomfortable to have these conversations, but what's even more uncomfortable is living on the street and being cold and in the elements. So I just want to encourage anyone and everyone to, if you see a path forward for folks, there's a lot of opportunity, especially in the community, with new housing opportunities, with new programs. And I think we're going to see a lot of momentum in the next few years. But just relentlessly engaging folks in a fair, kind, compassionate, equitable way is a very powerful thing. So with that being said, I want to let everybody know how thankful I am that you're here today and that I'm going to see you on the 22nd at 8 p.m.
That's great. So, I think Nick hit on well, right? Like the intention, though the point count is a federal mandate, the goal is not to just count folks, right? The ultimate goal is to connect people to services and housing. And this is something we want to use as a part of a larger strategy of developing a by names list of every person experiencing homelessness in our community, and ultimately improving our homelessness system so that increasingly we're able to meet folks where they are and begin to deliver services to where folks are and help them take the next step that they're willing to take. So with that, I'm going to walk through the survey. Then I'm going to ask Tracy Cunningham, our HMIS administrator, to kind of fix the things that we've missed along the way. And then we'll make some space for questions for you all. So we want you to see what the survey that we will be sending you out with looks like. So as you and your team go out, you'll have clipboards with multiple copies of this survey. It has a little bit of we're working on getting lanyards that say, Heartland Continuum of Care Outreach that folks will wear. We also have a bit of an introduction here that we invite you to give. Information really, and we've sort of said along the way, right, that if a person's not willing to share information, we want you to respect that. But we also want to reiterate that the more information that we can get captured through this, the better, right? So we obviously want to respect the person, respect their wishes, but we also want to collect absolutely as much data as is possible. So the questions after you give the introductions really sort of lead you through. So, we ask the person where they're sleeping that night. We ask them if they have a place other than where they are right now that they consider home. And, you can always ask follow-up questions, right? If you're not entirely clear, you can always, again, approach it in a conversational way. Were you asked these questions by anyone else tonight? So, one of the challenges when we send people throughout the community is that it's very possible that that a person might get engaged by different groups that are going out and conduct the pit count. That's not necessarily a bad thing, right? It kind of demonstrates that we're covering the areas that we need to cover, but we don't want to duplicate people in the count. So that's another reason why, putting the location and the time of the survey and as much information as possible, it helps us to make sure that we're not duplicating along the way. We ask the person for their name. If they're not willing to do that, we ask for their initials or anything that they would give us, again, to help with deduplication. We ask for their date of birth or age, and you can see that there's an age range below. So there again, if they're not willing to tell you exactly how old they are, you could say, well, would you be willing to, would you be willing to tell me what, or if you're in any of these ranges, and then ask them. As we said, we don't want to make assumptions about people. We want to ask them the questions and let them answer. So when it comes to things like gender, we want to know, how they identify, and there's the list there. Same thing for race. You'll see those there. Are you Hispanic or Latino? Are you a veteran or served in the U.S. Armed Forces? Do you struggle? And again, you'll see that some of these questions are personal, right? So you could see why a person may be willing to give you information, they may not, and that's okay. But do you struggle with one or more of the following? And then there's a list of those. And again, we don't want to make any assumptions. Do you receive any disability benefits, such as SSI, SSDI, Veterans Disability benefits? Are you pregnant? Are you currently experiencing homelessness or fleeing in domestic violence, dating violence, sexual assault, or stalking? Do you feel like you might be a victim of human trafficking? If so, do you want help? Beyond that, is this the first time you've experienced homelessness? We want to hear about their experience of homelessness, right? When did it start? How long have they been homeless? And you'll see that it's, you can, the way that this is kind of laid out, right? That if you can get them to kind of share their story and share more about their story, it can help you to kind of answer these as accurately as possible. In total, how many separate times have you stayed in shelters or on the streets since January of 2021? Here, what we're trying to get at is whether a person may meet the definition of chronic homelessness, which is 12 months, experiencing homelessness for 12 months over the time period of the last 3 years. So these questions really kind of help us get a picture of that. How many months did you stay in shelter or on the streets or in places not meant for human habitation over the past 3 years? And then there's optional questions. So, you might be able to, as you're interviewing, conducting the survey with someone, it might be going great and the conversation is flowing, or you might get the sense that a person is ready for you to leave them alone, and you can kind of feel that out. But there are some optional questions that you could ask one, you could ask all, right? But have you been contacted by a street outreach caseworker? There, we're trying to see if people are engaging with anyone, or if anybody from outreach services that has been able to be in contact with them. If they're not, would they be interested in? So this is kind of flowing into the work that kind of Nick demonstrated through his story, right? If a person is willing to access services, can we use this interaction to begin to make that connection? So this question about whether they need assistance with anything, this gives an opportunity for outreach workers to follow up. Do you have any medical issues that need to be addressed that we can refer you to services? Would you like to give any feedback or opinions, right? An opportunity to hear from the person about how the system is working for them, or what their experience has been like trying to access different services. And then the very last part, if the folks that you are engaging as a family unit, we ask for the following information for every person that's in that household. So that's something to be aware of. With that, I'm going to invite Tracy. Tracy is our HMIS administrator for the Heartland Continuum of Care. She helps us make sure that we're doing everything on the PIC count that we need to do to meet all regulations. Tracy, is there anything that you would like to touch on that either we haven't hit or got wrong so far?
Actually, no. You actually did. You covered everything that I was going to iterate, except for when they do not want to answer a question. I think my camera is all blurry here for some dumb reason. if they don't want to answer it, mark it that they don't want to answer it. That way, I then know that this is going to definitely be a refused versus a the volunteer didn't bother to ask the question situation. Because the process that I go through after all the after you guys and your outreach is completed, I get the paperwork, and then I have to determine if this is somebody who's already in our system. And I use many different things. I'll look at the race and the gender if I don't have a name, or if I have initials, and I take all of those to see, I do a lot of deducing to figure out if this is going to be a duplicated client or a not duplicated client. And as long as I know that it's a refused or they don't know the answer, just mark it. I'm not saying that it's a bad thing. I'm just saying just mark it. That way I understand it. Another thing that I do want to bring up that, like you were saying earlier, if you do manage to come across somebody that wants to go to shelter and you've already maybe completed this entire form, note it that you managed to get this person somehow either the ride to the shelter, or the police maybe took him over to the shelter, or a van came and picked him up to take him to the shelter, and that way I can check this person for the shelter to make sure that this is also not a duplicated thing. So just somewhere at the top there, say got client to helping hands, not just shelter, because if they go to contact, or wherever they go, I can at least check to see if they stayed that night. If not, we will use the data. Otherwise they're going to be on the sheltered survey, which gets pulled out of our system. Oh, and lastly, for those of you who don't know where Mercy actually is, it's 1344 North 5th Street. We're directly across from, the parking lot is directly across from 5th Street Renaissance offices. So that's all I have, Josh.
That's a good note. And I'm glad you mentioned that too, because you'll get into groups, we'll meet at Mercy, you'll go out into the community, and then at the end of the evening, you'll drop your surveys and any other materials that you have at 5th Street Renaissance, which is almost directly across 5th Street from where Mercy is. So that is sort of how the night will go. So
is there going to be somebody like inside the building at 5th Street watching for people to show up? Okay. I wasn't sure on if there's somebody like waiting in the car, or since they're typically not open that late.
Yeah, typically just go right in the front door there. And, in the past, different folks from 5th Street have been there to collect everything. All right. With that, we want to give you all a couple minutes. If you have any questions about anything we've touched on so far, or anything else you would like to share, please feel free to do that. And then we'll be done. And if you all are good, we won't belabor it too long. We'll let you all get back to the rest of your day. All right. Well, as we mentioned, we'll send this video out. If you think of a question between now and the 22nd, please don't hesitate to reach out to Jamie, Nick, or myself. I'm sure we'd be happy to chase down any information you need. With that, we really appreciate you all taking the time today to be a part of this. And we'll send out the slides. We'll send out the video to you here in the very near future. So take care, everybody.